Hello everyone, this is Dr. Khan, Executive Plastic Surgery, Bloomfield Hills, Michigan. So a very interesting case. This is a nice patient, 52 years of age with a set of implants from 2002. So she had capsular contracture grade 3 on the right, grade 3 on the left as well. A set of saline implants done in 2002 through the belly button. And so she comes in with full informed consent, wanting to remove them in the manner that I do. She follows me and closely on Facebook, and this is again part of the informed consent. She's actually very excited about her surgery. And so as you will see, complete end block, 1726, initials JN. As you will see, there's a lot of contouring that I did given the implant that was bottoming out. You can see they're a little bit hard. You can see the white, and the capsular tissue is a little bit hard. I removed some of this inflamed tissue that was present at the bottom. This is exactly how the implant was sitting. And if I cut through it, you will see it is a lot of scar tissue, inflamed tissue, like if it was moving about. This is where that inflamed tissue was. And as I cut through it, you can see it is not healthy appearing. It is hard, irregular, nodular in appearance. And because I did not like how it feels or palpates, I removed that as well. So what I'm going to do now is let me go ahead and enter over here and see what is an overfilled saline implant. We're going to go super slow. And complete end block was done. Again, this is very inflamed tissue right here. A lot of inflammation in the periphery. All of this tissue was removed. Because remember, it's not only the implant capsule, but that inflamed tissue as well that I incorporate, so that leaching of that fluid around the implant that falls into the periphery is also removed in my practice. Remember, the whole goal is to preserve the precious volume. So let me go in from here. There it is. It's a nice window, calcified, as we saw and I felt all in the entirety of the case. I'm going to go in over here. You can see how the implant is literally suffocated. Hold on end block, the gold standard. See, look how it's folded up on itself right here. Let me go in. Minimal blood loss, 5 cc's. Now I'm going to go ahead and see if I can cut through here. You can see the calcification, literally the scales of a fish. Now I'm going to go ahead and tease this out. Literally out of a shell. You can see there's no fluid on the inside. This is your 300, no name. Some fluid around, you can see this is where it was bunched up. Intact saline implant, what appears to be overfilled. You can see the pressure on the sides. And if I will, I'm gonna, this is not enough to send, but you will see a small amount of fluid that was present. And if I go like this, literally on my new sterile glove, you can see it's like sandpaper consistency. None of this spilled into the chest. Everything was contained, end block. You know, the other thing I want to show, there's some areas of it that were so thin, you could literally see through them. But all of this tissue removed. None of this spilled into the chest. And I'm going to send these along with the implants. I'm going to remove my top sterile glove. Important to use sterile glove because I'm going to get cultures from here. So I'm going to get cultures from here. So if you We'll, I have a new set of gloves here. So this is normally, if this is my culture swab, I'm just going to go in and I'm going to get some representative cultures like this, which I'm going to send to microbiology for aerobic, anaerobic, and fungal. Now this is the left side, and again, the entire implant capsule has been removed as one system. Some abnormal tissue, just like it was on the other side, I removed. All done en bloc. Now the whole goal here is to remove everything and everything that is bad, angry, inflamed, irritated. So anything that feels abnormal, looks abnormal, palpates abnormal is removed. And this is that millimeter by millimeter dissection. And it is done with utmost care and attention such that all of this tissue is removed definitively. So I'm going to go in here, calcified hard tissue. If someone says, why remove the capsule? You do not want to leave this hard shell behind, because then you're going to pick up on it on a mammogram or a self-monthly breast exam. And you can see how suffocated this poor implant is. It's literally being compressed inward like a hard ball, and this is the capsular contracture. So I'm going to go in from here. You can actually hear the implant capsule being cut. I'm going to cut right here. Now hopefully I can tease this out. You can see, look at that small amount of fluid. It kind of, if you stay there for a second. So I just got a syringe, and as you will see, this fluid, it's not enough to send to cytology. Let me see if I can. There's more here, but you can see they want like 3 cc's, but none of this spilled into the chest, and that's the beauty of the en bloc. Let me see if I can collect some more. So look at that shell. So none of this spilled into the chest, and if I avert this open, you will see a lot of calcification. Implants from O2. These were supposed to be the nicer, better, safer, and you can see this has this pasty appearance to it, like literally that white plaster. And this is what the patient was literally every time she would give a hug. You can imagine how with this would have hurt the patient. And so all of this will be going to pathology to rule out that rare BIALCL. The liquid is not enough to send. So as you will see, I just want to highlight, this is the con procedure. Complete, comprehensive, and confidently done. No need for the drains because all the badness is removed. No need for the lift. Deep sedation, which is no paralysis. This patient was on a weight loss medication, a GLP-1, and so for that reason, she ended up getting an endotracheal tube. High definition photos and videos. So this is, if you ask me, the most important thing. Your surgeon must show this off the chest wall, and certainly this as well, to basically prove to you that the entire capsule was indeed removed in the manner that it was. Number 5, the capsules are always into pathology, CD30 analysis, rule out breast cancer, malignancy, lymphoma, squamous cell cancer, the BIA, SCC, BIA, which is the breast implant associated squamous cell cancer, anything bad. Microbiology for aerobic, anaerobic, and fungal. Return the implants to the patient to show that these were not damaged or overfilled saline implants. And then all patients get the same surgery, no matter what the age, the comorbidity, because you don't want to give compromised care to the person who's older or sicker, if you will. And if they're sick, their surgery is done at the hospital. So as you will see, look at this, literally what is like mud type consistency. All of this removed completely, comprehensively, including this small amount of fluid. Not enough to send, but you can see, look at that cream consistency. None of this spilled into the chest, and I'm going to take cultures of that as well. And So the implants to be returned to the patient. You can see how the implant is literally breaking down. This is 300 as well. What is overfilled, you can see the pressure on the side. Capsules to be sent to pathology, rule out the rare BIL, CL, CD30 analysis, cultures for aerobic, anaerobic, and fungal, and implants to be returned to the patient. And we will see, most importantly, how the patient does post-op minus these toxins. This is Dr. Khan, Executive Plastic Surgery.